My name is Nicole Sirotech. I'm a registered nurse. I've been a registered nurse for over a decade. My specialty is critical care, trauma, and flight. Since the start of the COVID pandemic, I've actually been rebranded, I guess you can say, as a leading expert in early intervention strategies executed on a large mass scale using the FLCCC protocol, as well as COVID patient ventilator protective strategies to optimize COVID patients on the ventilators. My story actually begins back in May of 2020. I was one of the original nurses that went to NYC to help with the COVID pandemic because, as we remembered, they needed nurses. And most importantly, they needed ventilators. Well, I was the whole package, a flight nurse that can manage ventilators. And when I arrived there, the gross negligence and the medical, malfeasance that happened in there and the complete medical mismanagement of these patients is what has led us to the situation that we're in right now. The pandemic and the hysteria that was created from poor public health measures and poor execution of appropriate early intervention strategies and the handicapping of medical professionals doing their job has led to where we are right now and into the crisis situation that we are in. I will use several key case studies that will represent larger descriptive statistical information for what I'm going to speak of. But when I was in New York, and what continues to happen today, is that many of them are not dying from COVID. Now, many people don't know about me is that I'm actually a master's prepared biochemist, and I have worked extensively with the HIV virus, tracking genetic mutations. So I feel very comfortable going toe-to-toe with some of these doctors here, although I am not a doctor, I'm just a nurse. But what we saw in these front lines, we knew what was happening. And when we asked for the ibuprofen, they said, no, it was contraindicated. When we asked, why aren't we giving them steroids? Oh, well, it's not. We were just following orders. Following orders has led to the sheer number of deaths that has occurred in these hospitals. I didn't see a single patient died of COVID. I've seen a substantial number of patients die of negligence and medical malfeasance.